Hello, my name is Jeff. When I was 25 years old, my life was great. I had just graduated at the top of my class at Wentworth Institute of Technology and got a great job working as an engineer at Supfina. One night on my way home from work, a drunk driver ran a red light and hit the side of my vehicle. I was airlifted to the hospital where I was medically induced into a coma for 3 days. I had a broken femur and had metal rods and screws put into my leg, and then after that I was prescribed oxycodone to help with the pain for 3 months.
The U.S. prescribes more opiates than any other country in the world. The doctors are overprescribing opiate painkillers and are not educating their patients on the dangers.
I went back 4 months later to get the rods and screws taken out and they put in a cast. For the next year, I was in and out of doctor's offices getting my legs checked. The pain never went away, so the doctors kept refilling my prescription for oxycodone. I had to take more and more pills to get the same effect, but after a while, I grew too much of a tolerance to it.
Healthcare providers wrote 259 million prescriptions for painkillers in 2012. That's enough for every American adult to have a bottle of pills.
Throughout all this, I had to go to physical therapy to help gain strength back in my leg. I had met many people there and one girl named Bessie who had been through the same thing as me. I told her how nothing would help with the pain and she offered me an alternative way to help it go away. She invited me over that night to her house. I didn't ask many questions because I was desperate to make it go away. That night at Bessie's house, I walked in and saw needles on her coffee table. At first I was very reluctant, but it didn't take much persuading from Bessie. I still remember that moment of euphoria as I injected the drug into my vein. It was the best feeling I've ever experienced, and before I knew it, I was shooting up 3, 4, 5 times a day. I would use all my money from disability on heroin. Throughout all that, I became very depressed and lost contact with family and friends. Before I knew it, Bessie was the only one I needed. I knew it was wrong, but the relief and the high I got was unexplainable, and I just couldn't stop. People don't realize how easy it is to get addicted. It can happen to anyone.
4 out of 5 heroin abusers start on painkillers, just like Jeff.
One night, Bessie overdosed. I called 911 and the ambulance took her to the hospital where my mom was a nurse. It had been 3 years since I had last seen my mom. That night, Bessie didn't make it, but I knew I still had a chance.
In the past decade, over 6,600 people have died due to an opioid overdose in Massachusetts alone.
My mom saw me sitting in a chair in the waiting room and barely recognized me. I knew I needed help if my own mother couldn't recognize what I looked like. She got me the help I needed and treated me as a patient and not just another drug addict. I was lucky to have the support from my family to overcome this challenging experience. Many others don't have that kind of support from anyone, because addiction has a bad stigma and addicts look like bad people. They're the same as you and I, regular people who have a disease. Since I've become clean, I went back to work as an engineer, and I met my wife who I had 2 beautiful children with. And I've been giving talks like this to help educate everyone of the dangers of opioid addiction, because it can happen to anyone.
So here are some things that you can do to help prevent the opioid epidemic. You can make sure that you dispose of medications properly and avoid keeping them around.
Educate yourself before you start taking them. You can ask your healthcare provider or call Poison Help at 1-800-222-1222.
To get help for substance abuse problems, call 1-800-662-4357. Thank you for your time, and remember,
It can happen to anyone.